Hello, I'm Dr. Ajay Naik, cardiac electrophysiologist at SIMS Hospital, Ahmedabad. I'm an arrhythmia and heart failure specialist. Fainting is a fairly common phenomenon, and in medical parlance, it's called syncope. Now, when we talk about syncope, it's a brief loss of consciousness. It has abrupt onset and recovers fairly rapidly without need of any special efforts. So it's a spontaneous recovery of consciousness. In the vast majority, fainting or syncope is a fairly common issue and it does not have any lasting problems. However, if the fainting or syncope is due to cardiac causes, it can be life threatening. It could be ominous. If it's a non cardiac cause of syncope, like reflex syncope, in these patients, generally the outcome is fairly good. In the next 5 to 10 years, more than 90% of the patients will not have any problem. However, if it's a cardiac cause of syncope, the prognosis is not good. Almost 30% of the people would not be alive in another year, and 50% would not be alive in another 5 years. And the vast majority of these deaths are sudden cardiac deaths that account to almost 50% of all deaths. The difference between syncope and sudden death is that after syncope you wake up, after death you cannot. Now, cardiac causes of syncope could be many. It could be a person, young person, having abnormal fast heart rhythm, like what is called as a WPW syndrome, where there's an extra wiring in the heart. And that can be easily managed. We do a procedure called electrophysiology study and RF ablation. In 45 minutes to 1 hour under local anesthesia, we can localize the problem and treat it, and the person is permanently cured. However, there are other diseases where the patient has had a previous heart attack. The heart's pumping has gone down. The patient is suffering from congestive heart failure. There are valvular diseases or patients having hypertrophic cardiomyopathy. The heart muscle has thickened. Or there are certain familial or hereditary or genetic diseases where the patient can have sudden, fast, irregular arrhythmias called ventricular tachycardia, and that also can cause sudden cardiac death. These need to be diagnosed, investigated well, and treated appropriately. The treatment could be lifestyle changes, it could be management of medications, or it could be implantation of devices. If the heart rhythm is very slow, bradycardia, due to sick sinus syndrome or AV node disease, the switch or the junction box of the heart is not functioning well, and the heart rate has dropped to 20, 30 beats per minute. In these patients, they would require a permanent pacemaker implantation. Again, a 45 minutes, 1 hour procedure done under local anesthesia. In some patients, if it's a problem of ventricular arrhythmias with low pumping function or familial arrhythmias which are causing ventricular tachycardia, life threatening, these patients may require implantation of a defibrillator. And that again is a 45 minutes, 1 hour procedure done under local anesthesia. Some patients may have abnormally slow rhythm of the heart, bradycardia, where the heart rate drops to 20, 30 beats per minute. And that can be due to disease of the sinus node, the switch of the heart, or AV node, the junction box of the heart. These patients would require implantation of a permanent pacemaker. It's a procedure done under local anesthesia, lasts around 45 to 60 minutes, and typically the patient goes home the next day. This will solve the problem of syncope due to bradycardia. Some patients who have abnormally fast rhythms, ventricular tachycardia, which is life threatening, these patients require a slightly bigger device, which is called a defibrillator. Implantable defibrillator is put under the collarbone just like a pacemaker. Again, a procedure which is around 45 minutes to 60 minutes, done under local anesthesia. That works whenever the fast abnormal rhythm occurs. It delivers a shock or anti-tachy pacing and terminates the fast rhythm and restores normal rhythm. This saves the patient's life. Certain patients who have low pumping function and are prone to getting these ventricular tachycardia, abnormal fast rhythm of the heart, may require a bigger device which is called a CRT defibrillator. It does two jobs. It improves the pumping function of the heart and also protects the patient against sudden death due to ventricular tachycardia. So the causes of cardiac syncope are different. They could be fast rhythms, they could be slow rhythms. They need to be investigated, diagnosed, and treated appropriately. So fainting is a fairly common symptom, but if it is a cardiac cause of fainting, cardiac cause of syncope, that could be ominous and it could be a harbinger of sudden death. So if there is an episode of fainting, we need to investigate and diagnose the cause and treat it appropriately. I'm Dr. Ajay Naik, cardiac electrophysiologist at SIMS Hospital, Ahmedabad. In this arrhythmia and heart failure series, we'll be talking about more such problems and we'll be giving more such information. Please take care of yourself and your significant others. Thank you.